Hello everyone, welcome to the Pharmawalk channel. Today we'll discuss the various. So, team, let's understand routes of drug administration. That means via which area drug will enter into our body. Very basic and simple, that is enteral. Enteral word always related to GI tract, gastrointestinal tract, which start with mouth and end up with the large intestine. So this is the enteral route. Second, parenteral. Parenteral means other than the enteral, other than the GI tract, which involves injections. Then transdermal, application of drug via layer of skin. Topical, to the localized part of our body for the localized effect. And inhalation. Inhalation means administration of drug via the nasal route. So these are the various routes of drug administrations are available. Now let's understand one by one in detail. Now let's start with the enteral route. So as I shared, enteral word related to the GI tract. That means placement of drug directly into any part of the GI tract. That's called enteral mode of drug administration. There are sub-classification is also there. First, when drug is placed to the oral cavity, or we can say mouth or the buccal cavity. Then rectal. Rectal is the part of large intestine or the colon. So when drug administered via that route, known as the rectal administration. Then inside the mouth, sublingual. Sub means below and lingual means tongue. So below the tongue. Then also the buccal cavity, placement of the drug in the buccal cavity. So how we can remember easily? ORSB, oral, rectal, sublingual, buccal. These are the four subtypes of enteral route. Right, let's understand the advantage benefits of drug administration via this oral route. So simple, safe, convenient, patient can take or self-administration is possible, painless procedure. Now some demerits are also there, disadvantages are also there with the oral route. First, slow onset of action. It varies from drug to drug, but definitely when any drug administered via this oral cavity, onset of action is slow. Not suitable for the drug which can be destroyed in the presence of acid or having the first pass metabolism. We know that strong HCl, hydrochloric acid, is present in the stomach. So the drugs which can be destroyed in the presence of acid cannot administer via this route. Another disadvantage is the drug which having the first pass metabolism, highly first pass metabolism. What is the meaning of first pass metabolism? That means metabolism of drug into liver before it absorb into the blood, before it showing the action. So drug which having the high first pass metabolism cannot given via this route. Then cannot given to the patient who are unconscious. जो बेहोश है, the oral route of drug administration is not possible. So even though it's a simple, convenient, painless procedure, but these are some demerits of the oral routes of drug administration. And also palatability of drug, the taste of the drug, it's very important. Examples: tablet, capsule, powder in the solid dosage forms, and the liquid syrup suspensions. Now second, rectal means administration of drug via the last part or the rectal part of the large intestine. Which are the benefits? So it can be used for the patients having nausea and vomiting. Obviously, when patient having the nausea and vomit, it's difficult to administer tablet or capsule via the oral route. So this is the route it can be given to the patient having nausea and vomiting. Also, the chances of first pass metabolism is less. And third, it can be used for the gastric irritant drug. Demerits of the rectal administration. Chances of rectal inflammation could be there. And also absorption is unreliable. Examples are glycerin suppositories. The suppositories are used to treat constipation. Now third, that is buccal and sublingual. So buccal means placement of the drug in the buccal cavity. Drugs placed into the buccal area of the mouth. Sublingual, sub means below, And lingual means tongue. That means drug placed below the tongue. Advantages: faster onset of action. It avoid first pass metabolism, means it directly enter into the blood. Demerits of the buccal or sublingual route. Drugs with the high molecular weight cannot given via the examples: nitroglycerin tablets administered via the sublingual route, useful for the anginal attack, chest pain. So this tablets directly needs to put below the tongue. It causes the vasodilation, so directly enter into the blood. So this is an example of sublingual route. So this all about the oral route. Now let's understand the parenteral routes other than the enteral. Injections, very common. Then inhalation, intranasal route, transdermal, and topical. So all these four types, these are the routes other than the enteral, which does not involve any part of the gastrointestinal tract. So let's start with the first category, that is injection. It also has the sub-classification based on the site of injection. First, intravenous, intramuscular, intraperitoneal, intrathecal, intramedullary, subcutaneous, intra-articular, intra-arterial. So let's see the intravenous. The word itself indicates injection in the vein. Vein is the blood vessel which is there in our body. So the injection directly into the vein known as the intravenous administration. Let's understand benefit of the intravenous injection. Faster onset of action, and also it will bypass the first pass metabolism, and this is the only route which having the 100% bioavailability. That means percentage of drug available in the blood for showing its action, and it also can be given to the unconscious patient. So these are the major advantages of drug administered via the intravenous route. Demerits: when we inject a drug directly into the vein, strict sterility, or we can say aseptic condition is required. Second, skilled person is required. So self administration is not possible. Skilled person is required for the administration of drug via intravenous route. Introduction of any matter, any impurity can be fatal. Sometimes it can lead to the death of person also. And drugs in the suspension or the oily drugs cannot administer via this route. So these are some demerits of intravenous administration. Examples are glucose or normal saline can administer via intravenous route. Moving ahead, intramuscular. Again, the word indicate the meaning of the injection. Injection in the muscle. Advantages of this route: absorption is predictable, the port injection can be given. Let's talk about some demerits. In this route also, strict aseptic condition is very much required. Again, the skilled person is required. Self administration is not possible. There might be chances of swelling at the site of injection. Most of the vaccines administer via this route. So sometimes due to that administration, swelling happens. And also large volume of drug cannot administer via this route. Examples: depot injection of testosterone. Moving ahead, intrathecal or intraspinal. Injection into the subarachnoid space. Advantages: it will bypass the blood-brain barrier. And demerits, again, if we see for the most of the injection or the parenteral route, strict aseptic condition is required. Great expertise is required to give this kind of injection. Not every person can give intrathecal injection. Painful and quite risky. Moving ahead, intrathecal or intraspinal injection examples: xylocaine injection for the providing spinal anesthesia. Next route, let's intramedullary. That means injection into the sternal bone marrow. Merits: faster onset of action. And if we talk about the demerit, same strict aseptic condition is required, great expertise is required, and again it's a painful and quite risky. Next, intra-arterial injection into the lumen of desired artery. Arterial means injection into the artery, which is also the type of blood vessel. Merits: higher concentration of drug can be delivered at the desired site of action. Disadvantage or demerits: same strict aseptic condition. Sterility is very much important. It's a painful administration. Then intra-articular injection directly into the joint space. Benefit: higher concentration of drug into the localized area. And demerits: same sterility is important and repeated administration may lead to the joint damage. So this is the disadvantage of intra-articular injection. And also it's a painful. Now last one, subcutaneous injection into the subcutaneous tissue which is there under the skin. Merits: smooth but slower absorption for the longer period of time. The port injection or the implants can also be made. Demerits: applicable for only small volume, maximum 1 ml. Irritant drugs cannot be given. All these other cutaneous routes are also there. For example, intradermal injection into the dermis layer of the skin, dermojet injection, pellet and biodegradable implant, epidural injection. After that means the drug is injected through a vertebral interspace between the dura of spinal cord and the lining of spinal canal. Intracardiac injection directly into the heart. After the injection, moving ahead, second category under parenteral, inhalation administration. Administration of drug through the nose or the mouth. Merits: faster onset of action and also self-administration is also possible. Demerits: sometimes there might be chances of bronchial irritation. So that's all about the inhalation route. Third, transdermal administration. That means administration of drug via layer of skin. And this route provides systemic effect, means drug will enter into the blood. Advantage of transdermal route is that it avoids first pass metabolism, means it does not metabolize into the liver, it directly enters into the blood. Last, that's topical route. Application of drug to the specific part of our body which provide local effect. Drug does not enter into the blood which administer via the topical route. Let's summarize this topic. Routes of drug administration basically divided into the two parts. First, enteral administration of drug via GI tract. Second, parenteral, which is other than the enteral. Enteral also has subclassification ORSB, oral, rectal, which is the part of large intestine, sublingual administration of drug via area below the tongue, buccal placement of the drug into the buccal cavity, ORSB. Let's talk about parenteral subclassification. First, injection. There are also other categories based on the site of injection, but very importantly, aseptic condition needed when drug administered via the injection route. Inhalation, administration of drug via the nasal or the mouth. Transdermal, drug administration via the skin route and which will provide systemic effect. Topical, application of drug to the specific area of our body for the local effect. Thank you so much. I hope you have liked this video. Please like it, share it and subscribe to our channel.